845 55 KRC, the talk station. I'm going to consolidate our KRC Cares segments into one long one, and it's a really important one. Joining me to talk about a UV Safety Awareness Month, ultraviolet rays, and skin cancer, Dr. Suzanne Partridge. She's one of the outstanding physicians at OHC, which happen to be my cancer doctors, a leading medical oncology and hematology expert who treats melanoma and other forms of cancer, uses advanced therapies to successfully treat patients with various forms of skin cancer, and her expertise has helped many patients overcome their diagnosis and have healthy futures with better protection from the sun and other risk factors. Welcome to the studio, Dr. Partridge. It's a real pleasure having you in here today.
Thank you, Brian.
And as I mentioned to you, I just had my dermatology appointment. I have a standing appointment every 6 months. I am a poster child for skin cancer. Yes. Fair skin, Northern European descent, blue eyes, burned severely several times. I was a lifeguard. Nobody used sunscreen back in the day. Even a couple of bouts of sun poisoning where it feels like red ants are crawling over your body. So that sets me up for a long-term, down-the-road potential to have a serious skin cancer, does it not?
It can, but it's not just because you're not in that category, you should still be monitored. I've had people in my office that don't have that type of background. In the past month even, I've seen people that wouldn't be a typical risk factor. So it should really go across to everybody.
But if you're me, at least in terms of your background, you definitely want to get a dermatology appointment.
Correct.
Get one on the books because it's going to take you a little while to get one. They're in short supply and high demand.
Yep. And also your primary care doctor, they can screen you as well. And sometimes if they see something that's suspicious, they can get you in faster. So you don't necessarily have to wait for a dermatologist.
Fair enough. PCP, great place to start. Well, let's start here in our conversation talking about the different types of skin cancer. What skin cancers are out there? Because I've had some growths removed, but so far I haven't gotten the diagnosis of the really bad one.
Yeah, so there's usually about 3. There's some rarer ones, but we talk about basal cell as well as squamous cells. Those are more of the local skin cancers that usually just need excision. Not a lot of other treatment needed usually, as long as you don't wait too long.
Like freeze them off kind of thing?
Correct, or you cut them off. Sometimes you need a special type of surgery. Melanoma is the one that can get more serious, and it can unfortunately invade into the rest of our body. So that's the one you got to really look out for.
And that's the metastasized problem. You get it on your skin, but next thing you know, your entire body is covered with cancer. But well, before we get to prevention, what are you looking for when you're self-examining? I mean, I've got a little mole here, but I've had it ever since I was a little kid. There's nothing to be seen. There's nothing to bother with it. But what of other things? What are we supposed to be keeping our eyes out for?
Generally, you look for anything that's changing, something that's bigger than the size of a pencil eraser, however, it can be smaller. If you have something that's changing color, or you have various colors in that mole, I always tell people bleeding is not something to ignore. Something that's changed rapidly would be something you would bring to an attention.
Okay, how about something that has like dimensional, like it sticks up, like I think of a wart almost, but has a 3-dimensional component to it? Is that something, or is it questionable?
Sometimes, but not always.
Okay.
There's a lot of benign skin lesions that may be worrisome to people, and I spend a lot of my time reassuring people. But, how do you know? And that's what we're here for, to help you differentiate.
Exactly. All right, what do we do to prevent skin cancer?
Well, number one, from birth, anytime we're out in the sun, you definitely got to be putting on sunscreen, at least an SPF of 15. Try to avoid times in the sun where it's strongest, 10 to 4, but I know that's a lot to ask. Hats are important because a lot of us don't cover our scalps. And then my big thing outside of summer weather is avoiding tanning beds.
Yeah, they're cancer machines.
Yes, and it really happens a lot in teenage girls. And we've seen unfortunate cases of 20-year-olds getting melanoma that are advanced. Oh, my God. It's completely tragic. And so I always try to, I know it's beautiful to look tan.
See, that's what we need to change is the mindset. That's a stupid look, right? That we should all transform our vision and say, all right, well, if you're walking around with a real deep tan like that, that means you're more likely to get skin cancer, and you're going to have leather skin when you get older.
Yeah, that all changed when tanning became popular back in the 60s. And we were all here hundreds of years ago. The fairness would be preferred.
All right, well, let's move over to risk factors. Are there any risk factors that make someone more susceptible to skin cancer other than a lot of exposure to the sun?
Definitely, we pay attention to family history. Certainly, if there's a family history of skin cancer, the radar goes up. And there can be other cancers linked to melanoma, so you want to make sure you know a family history of breast cancer, ovarian, pancreatic cancer. Sometimes there's a link there.
Lymphoma not on the list, though.
Lymphoma, generally, no.
Good.
So family
just
history.
throwing the personal into the discussion. I get my questions answered, too.
That's all good. You're in the clear on that.
All right. Fair skin with freckles, I see.
Yes. And again, we go back to the sunburns. I think mostly we've covered what we really want to pay attention to.
Okay. Individuals at risk specifically for melanoma, a more dangerous form of skin cancer, typically have what?
The fair skin, the blue eyes. Typically,
moles?
Yes, multiple. Sometimes people have more moles than others. And again, if there's changing moles, I think people that have a lot of moles on their body should definitely see a dermatologist at least once or twice a year, just to make sure.
All right. I tell you what, it really is peace of mind. I mean, because, I go back to my father, and that was kind of the predicate for me wanting to get off my butt and start paying closer attention, was my father spent so much time out in the sun. He played baseball when he was a little kid. He lived on the golf course his whole life. And, toward the end of his last 15 years of his life, he had so many things removed off his face.
Yes.
And I do believe at one point he did have the melanoma problem. So that scared me.
We even have people that don't have melanomas that have multiple squamous cells that the dermatologist can't even keep up with removing them. So those patients sometimes need to see us at OHC because we have systemic treatment to kind of cover the whole base. But obviously, coming in for an IV treatment every 3 weeks is probably not as desirable as being preventative.
Well, good. Get ahead of it, please. All right, now, speaking of treatments, OHC are the folks to call. If you get a cancer diagnosis, do what I did. It's 888-649-4800. You can learn, go online to the website. You can learn more right now at ohcare.com. Hopefully don't tune out of the balance of this because now we get to talk about the treatments that are available at OHC for skin cancer.
Mm-hmm. So sometimes we need a little bit more treatment than surgery. So my role being a medical oncologist, sometimes we have to help patients prevent relapse or treat something, unfortunately, that's already maybe too far gone in terms of surgery. So a lot of times these days we are doing molecular profiling or tumor profiling to help figure out for that patient what's the best option for them. Many melanoma patients these days are going to get options where the immune system, or what we call immune therapy, is very effective for them.
Oh, that's great because that's a growing area. I mean, every time I talk to OHC, there's another type of cancer you are going after with this particular protocol.
Definitely, and I call myself a mid-career doctor now. Back 20 years ago when I was finishing training, or 15, I should say, I remember offering patients treatments that were 5% benefit. And that was very unsatisfying and very difficult. And when you turn something into now a 60 or 70% benefit, and I'm actually seeing people survive this, that's been a really outstanding, at least personally, to see people improve and actually we impact them now. And I only see it getting better.
Well, you have the right to have hope when you got that kind of percentage, right?
Correct. And I can't even tell you the number of people that are here today because of these treatments that would not have been here 15 years ago. And I have people in my office that are 5 and 10 year survivors that wouldn't have been with us 20 years ago for sure in a 6-month period.
Well, an untreated melanoma, how aggressive is that before we part company here today? I mean, you have to act with some urgency, correct?
Well, I mean, I think it depends on where you find it. Not to scare people, because if you catch a melanoma really early, you're going to do very well. You have a 90% chance of being cured. It's when it gets into the lymph nodes that you're high risk to relapse. And if it spreads to other organs, if it comes back, if you didn't treat it, your prognosis is generally under 6 months to a year. So when we're impacting people to live in long-term remissions for years, that was not something we had the eyesight of 15, 20 years ago. And it's just been an amazing thing to witness, but it's still not enough. We still have people that don't do well. And so we still need to move forward. We still need to push the button higher.
That's why OHC's there doing all the clinical trials and being on the cutting edge of cancer therapies. There is hope, and it's at OHC. I got tons of hope from OHC when I was getting treated. ohcare.com is where you find them online. Dr. Suzanne Partridge may be your physician if you're dealing with these issues involving skin cancer. One of just the great doctors there, among many. The number 888-649-4800, 888-649-4800. Dr. Partridge, keep up the great work, and thanks for the wonderful information you pass along to my listeners today.
We appreciate letting GoHC serve the community.
My pleasure having you on to spread the word.